A mom who almost lost her teenage son to suicide is now helping families across the country navigate the confusing world of insurance and benefits, hoping to bridge the gap for others.
Our National Investigative Team's consumer reporter, Rachel DePompa, sheds light on her fight for coverage and how she's helping others. Here's Investigate TV's Relentless.
We open many doors in our lives. But one snowy Maine day, Carmen Bombeck opened the door to her 14-year-old son's bedroom. To a moment no mother, no person can ever be prepared for on the other side of a door.
I came home from work and I came upstairs to see if my son wanted to play a game. And I found that he had hung himself.
Carmen immediately called 911 and worked to save her son's life.
It was 30 hours until he regained consciousness. It was the longest day of my life.
The day slowly turned into years of fighting, not only for her son's mental health care, but its cost and coverage.
I think consumers in the United States are aware that insurance companies, it might be challenging. We might be skeptical about how things will go. It's worse than I could have ever imagined.
A year later, her son's condition deteriorated again, and he ended up in the emergency room. She was trying to get coverage for different treatments, and the denials were piling up. She estimates she spent 1,000 hours filing claims and appeals.
It didn't seem to matter how good my appeal was, how compelling it was. I was going to be denied anyway.
In fact, a new government report shows therapists and other behavioral health providers cut hours, reduced staff, and closed programs, turning away patients during the pandemic as more Americans needed care. According to data from the Centers for Disease Control, during the first 7 months of the pandemic, there were 26% more emergency room visits for suicide attempts compared to the same period in 2019. Carmen teamed up with Wellbeing Trust, a national foundation focusing on changing the way the nation is addressing mental health. Together, they've created this 83-page guide to give families the tools they need to access their own benefits.
Does it say something about our system when you need a guide to help you navigate?
It says a lot about our healthcare system. We know that most individuals seeking for mental health are probably around 6 times more likely to pay out of pocket for those mental health services than they are medical services.
I had to help other people because it's just unfathomable to me that the treatment we were subjected to by our insurer is legal.
Carmen was persistent and eventually got a denial for a residential treatment for her son overturned, so he's now covered for that treatment. Today, he's 18 and just wrapping up his freshman year of college.
I feel thankful every single day.
This guide is out now. It's called Healthcare Coverage for the Relentless, and you can get a copy at wellbeingtrust.org. It covers all of the terminology used by insurance companies and how to exhaust your appeals process.
Rachel DePompa, Valley News Live.
Now, if you or someone you know is in crisis and needs to talk, call the National Suicide Prevention Lifeline. It's toll-free 1-800-273-TALK or text HELLO to 741-741.
Carson Wentz is back in town and for a good cause. Beth is in.